Hi, how are you? I'm Rose. I'm Dr. Hughes' cosmetic coordinator.
Hi, Rose. So nice to meet you.
Welcome to the practice.
Thank you.
So tell me a little bit about what your main concerns are today.
Well, there's some areas in my face that, if non-invasively could be corrected, I would be delighted about.
Okay, I'm going to ask you that you hold on to the mirror, okay? And what I'm going to ask that you do is I'm going to have you look down into the mirror, because then we're going to be able to see those imperfections and talk to you about how certain products are going to help to enhance your look, okay? So I'm going to have you take a peek. Perfect. Some of the areas that we start losing volume is right here in what's called your nasal jugal groove, your under eye and your tear trough, okay? A little bit in your temples. We start losing volume in our forehead and our brow starts to drop just a tiny bit. And then you also lose a little volume in your cheekbone, which creates a little bit more heaviness in that nasolabial fold.
I can see that.
Okay, and then it also creates a little bit of heaviness too in the marionette. You can actually place some filler right in here, right underneath that eye a little bit, and right on the cheekbone and right up in this temple area to really give you a little bit more volume in there. And when we volumize that area, you're going to soften the nasolabial fold.
I can see that.
Okay, you're also
better.
Good. And you're also going to soften that marionette line just a tiny bit. Okay. So this is a nice area for people to revolumize with your dermal fillers. You talked to me a little bit about your jawline.
Yes.
You talked to me a little bit about, again, that pre-jowl sulcus is what that's called. You pointed to that.
Yes.
And we're going to talk a little bit about how volume, again, when we lose volume on the jawline and we lose volume in the pre-jowl sulcus, you're really seeing a little bit less definition to the jawline. So we can actually place filler all the way across that jawline here. Okay, and then a little bit in what's called that pre-jowl sulcus. It's going to make you cheat for a while. So if you're not ready for that facelift or you're not ready for a neck lift, it's a really nice way to just enhance the lower face.
Is that what they would call a liquid facelift I hear of?
Yes, I mean liquid lift is a combination of doing neurotoxins as well as fillers in different areas of the face. So you're absolutely right.
And it's completely non-invasive, and that's what I'm trying to achieve.
It's completely non-invasive,
That's
absolutely. So again, I'm going to have you take a peek in the mirror.
Okay.
And I'm going to actually have you make some faces for me for just a minute, okay? First, I'm going to have you raise your eyebrows. Perfect. See how you have a little bit of fine wrinkling across your forehead?
Yes, I do.
And then make that mad face for me. Scrunch in the middle. Good. So those are the lines I think that concern you the most. Okay?
Yes.
Good. And then smile big for me. Okay. So for you, we would strongly advise that we put a little bit of neurotoxin right in between the brows, which is actually going to stretch this just a tiny bit and almost give you a little bit of a mid-brow lift. Okay?
Great.
When we do your toxin in here, it'll help lift the central brow, and it can also actually lift the lateral brow just a tiny bit as well.
I would like that.
So people do really well with that. We also talk about the forehead lines, okay?
Yes.
Now Dr. Hughes is a little more conservative in the forehead lines because you have to be careful about over Botoxing or over putting fillers in there or products in there because people feel a little heavy if you do too much there. We would, treat you a little bit across the forehead, a little bit in that glabella area.
Okay.
And then we could also think about doing a little bit right in what's called the crow's feet because I want you to, again, smile big for me. Okay, so some people get a little bit of crinkling right here, and what your neurotoxins are going to do is it's going to soften your muscle function. You're still going to smile, you're still going to talk beautifully, you're still going to be able to express, but it's just going to soften everything for you.
That's terrific. That's just what I'm looking for.
We're going to also talk a little bit about your lip lines, okay? I know it wasn't your primary concern today.
I should have mentioned that.
Oh, okay, perfect.
The longer I look, the more I find.
So ultimately, when we look at the lip area, it's all restorative when you put filler in. Dr. Hughes is, again, all about that natural approach, and we're not trying to create an immense amount of volume in your lips.
I really appreciate that.
Or change the shape of your lip. What we're really looking to do is restore the lip.
Okay.
And we all start losing a tiny bit of volume above the lip line in that vermilion border. And we also start losing some volume and create a little bit of wrinkling vertically here.
Yes.
Okay, so there's softer products on the market that we can use actually to fill those fine lines in.
Oh.
And it's nice and long lasting, so you'll certainly get a nice response with that, completely non-invasively as well.
Wow, I'm excited about that.
So what we're going to do next is we're going to mark up your face. I'm going to use a little marking pen, and I'm going to show you where the filler is going to go in your face, okay?
Great, thanks, Ruth.
So we've marked up a good bit of your face already, okay? And we're just gonna finish up. But what I want you to lastly do for me is I just want you to put that lower lip above your upper for me and pout. So there's a muscle that actually curls that corner down like we talked about. Dr. Hughes is gonna go ahead and put your neurotoxin right in there, okay? And that's gonna help soften that look for you, okay?
Interesting, yes.
Perfect.
Come visit me, Dr. Susan Hughes, and my staff for a complimentary consultation. Enhance your natural beauty at the Hughes